Why your 30s are a critical window for heart and kidney health. Many people view heart disease as a later life concern, a condition to be managed in one's 50s or 60s. Because young adults often feel healthy and may only see slightly elevated numbers during annual checkups, they frequently overlook the long-term implications of their cardiovascular data. However, recent longitudinal research indicates that the physiological trends established in early adulthood act as a blueprint for health outcomes decades later. Small, seemingly insignificant elevations in blood pressure during your 30s can have a cumulative, compounding effect on the body. The study, Tracking Decades of Health to Understand the Long-Term Impact of Early Life Blood Pressure, researchers conducted an extensive study analyzing the health records of nearly 300,000 adults. This was not a snapshot in time. Instead, researchers tracked participants from their early 30s through midlife. Key aspects of the research included consistency. Participants underwent multiple professional blood pressure readings over a 10-year period. Holistic variables. The study accounted for lifestyle factors such as smoking, alcohol consumption, physical activity, cholesterol levels, and blood sugar to ensure the results were not skewed by other health behaviors. Long-term follow-up. Researchers monitored the participants for an additional decade after age 40 to track the onset of heart disease, stroke, and kidney disease. By using this longitudinal approach, scientists were able to measure the cumulative impact of blood pressure, how the duration and consistency of elevated readings matter just as much as a single high measurement. The findings: the cost of slightly elevated numbers. The data reveals a stark correlation between blood pressure levels in your 30s and the risk of serious disease in later life. Even moderate increases in pressure significantly heighten the danger to the cardiovascular and renal kidney systems. The impact of systolic pressure. The top number, systolic pressure, measures the force against your artery walls when your heart beats. A systolic pressure, roughly 10 points higher than peers over a 10-year period, was linked to a 27% higher risk of heart disease and a 22% higher risk of kidney disease. Those with the highest cumulative systolic readings were 3 to 3.5 times more likely to develop these conditions compared to those with the lowest readings. The impact of diastolic pressure. The bottom number, diastolic pressure, measures the force against your artery walls when your heart rests between beats. A diastolic pressure, roughly 5 points higher over the same period, increased heart disease risk by 20% and kidney disease risk by 16%. Notably, these risks were consistent across both men and women, suggesting that biological sex does not insulate an individual from the dangers of early-onset hypertension. Proactive strategies for long-term protection. The most important takeaway from this research is that early intervention offers compounding benefits. Addressing minor fluctuations in your 30s can prevent the significant physiological damage that leads to chronic disease in your 50s. To protect your future health, consider these science-backed lifestyle adjustments. Consistent monitoring. Don't rely on a single yearly checkup. Use regular home screenings or annual doctor visits to identify trends before they become dangerous. Dietary shifts. Focus on reducing sodium intake and increasing consumption of whole foods, such as vegetables, fruits, legumes, and lean proteins, while limiting ultra-processed items. Physical activity. Aim for at least 30 minutes of moderate exercise, such as brisk walking on most days. Weight management. Even modest weight loss can have a measurable, positive impact on blood pressure readings. Stress mitigation. Incorporating practices like meditation, yoga, or daily walks can help manage the physiological effects of stress. The bottom line: blood pressure in your 30s is not just a temporary metric. It is a predictor of your future vitality. Small, consistent lifestyle changes made today can significantly reduce the risk of heart and kidney disease decades down the line.